I'm Alison Dixon, a geriatrician in Halifax, Nova Scotia, and a focus on my practice is caring for people with Parkinson's as they age. You may have heard the term Parkinson's psychosis before. We use that term to refer to hallucinations and delusions in Parkinson's. A hallucination is when you experience something that others don't. That might be seeing, hearing, smelling, tasting, feeling something that's not there. A delusion is a false thought, worry, or belief that isn't true but feels very real to you. Here are the top 10 things you should know about Parkinson's psychosis. The first, number one, is it's very common. You are not alone experiencing this. About 50% of people living with Parkinson's will experience hallucinations and delusions or delusions. It can happen at any stage of the disease, but it's more common in the later stages. When it happens early on in the course of Parkinson's, it may be related to a recent dose increase or medication change that you've had. Number two, visual hallucinations. This is the most common type of hallucination in Parkinson's. Early on, people often describe what we call minor hallucinations. So an example might be you see something pass by, a shadowy shape or a form in your periphery, and when you look, it's not there. Some people also explain feeling a presence of someone else in the room where they feel like someone's standing behind them and they look, but there's no one there. Some people experience things that we call illusions or misperceptions, where a speck of dirt on the floor could look like a bug, or perhaps a pile of laundry on a chair in the bedroom might look like a dog or an animal there. As time goes on and as things progress, those visual hallucinations may become more frequent and they may become more detailed and well-formed. Something people describe quite often is seeing things like children or people or even animals, for example, seeing dogs out in the backyard when they're not there. Number three, we'll talk about delusions. So delusions are those false thoughts, worries, or beliefs that aren't true but feel very, very real. Some examples of that might be things, worries that someone's trying to harm you or out to get you, somebody's trying to steal from you, or people are lying to you. Some people might have the feeling or the belief that someone's living in their house, even though they don't see them there. Some people might feel like their partner's cheating on them, or that somebody close to you and trusted has been replaced by someone else, like an imposter, or there's two of them, and one's the real person and the other is not. As you can imagine, for the person experiencing this, it's unbelievably distressful, and it can be for care partners and loved ones too. Number four, we'll talk about insight. And that refers to a person's understanding of whether an experience is real or not. Early on, when people experience things like hallucinations, for example, people might say, I saw a cat in the kitchen this morning. I know it's not there. I know it's not real and we don't have a cat. As hallucinations progress, sometimes insight is lost. And so you may, as a care partner, see someone you love with Parkinson's who's setting a place at the table for someone who's not there, or perhaps they're putting out a bowl of water for that cat that's not there. So as time goes on, sometimes the understanding of whether it's real or not can become quite muddled or lost. Number five, and one of the big points that I'd like to reinforce, is that it's really important to talk about it. So please tell someone if you're experiencing this in your journey with Parkinson's. It's really important to let your friends, family, your medical team know that you've experienced hallucinations and or delusions. You don't have to have both together. Some people experience one or the other. When this happens, you generally need a really good review, so a history and a physical exam, and a good review of your medications, both for Parkinson's and other. And this helps us determine if the hallucinations and delusions are caused by Parkinson's or something else. So for some people, it might be a side effect of a medication. Some people experience this when they're sick, when they've had an acute illness. The things that I like to ask about is it new? Is this something that you've experienced before, or is this brand new? And did it come on suddenly or gradually? So often people may say, I see these things, the minor hallucinations we talk about, the shapes going by, And now, just the other day, I looked outside and I thought I saw a child climbing in the tree. If it comes on suddenly, you wake up one morning and you're having very detailed hallucinations and you never have before, that's an important detail for us to know. I often ask people, has anything changed recently in your health? So, are there any signs that you've been sick or unwell, recent surgeries? Even quite simple things are very important to me, knowing how often someone's bowels are moving, if they're particularly constipated or maybe have become dehydrated. I also want to know about recent medication changes. So it's important to talk to your team about any new medication you've been prescribed, even not related to your Parkinson's, any over-the-counter medication you've started taking, or if you've had any recent dose changes in your medications for Parkinson's. Number 6, and the important point, is to try to identify the trigger. So this is a big thing that your care team will do. Delirium, and you may have heard this term before, is something we call an acute or sudden change in memory or thinking that happens when people are unwell. It happens as the result of something else. And so an example might be when somebody develops something like a pneumonia and you're in hospital and you're unwell and you acutely are not yourself and might experience hallucinations. That, as a hallucination, you can imagine with delirium, it's a sign that somebody's not feeling well, that there's something going on medically. And so I always like to rule that out when hallucinations have come out of the blue. If it's related to a recent change or increase in your Parkinson's medication, sometimes your care team might go back down to the previous dose that you've been on. And I like to try to identify any other medications that might be contributing. I always want to know, too, if there's anything else that changed along with the development of hallucinations or delusions. Have there been changes in your mood, depression, or anxiety? Have there been any changes in memory or thinking that you've noticed or your loved ones have noticed? And please never stop or wean your Parkinson's medications without checking with your care team. As you know, you can't stop these medications suddenly. We don't make quick changes. So this is something you have to discuss your medications with your care team before any changes are made. I always want to know from people experiencing this if it bothers them. So are the hallucinations and delusions distressing? If they're not, we don't often need to treat them. So for example, seeing occasionally that cat in the kitchen or a child out in the yard, if it's not worrying you, it's not intrusive, it's not distressing, then you don't have to have treatment for that. For some people, when they develop hallucinations or delusions, you can imagine it can be very, very frequent and distressing for people and impact their quality of life. That's when we think about treating those with medications. So there may be antipsychotic medications that we use. One's called quetiapine to help. And we also want to know about changes in memory and thinking, because if that's come together, then we may use a medication that we use for cognition to help with those. But I will say that developing hallucinations or delusions doesn't mean that you've developed dementia. That's a very common fear that I hear about, and they don't always come together. But it's always important to review that, especially when you see your Parkinson's team. My number 8 point is talking about communication, because this is a really important thing when you're experiencing hallucinations or delusions. It can be really scary for the person experiencing them, but also for the loved ones around them as a care partner. And you can imagine the initial reaction for a lot of people is wanting to correct somebody. And so if you've seen a person in the kitchen that you don't recognize, the person you live with or a care partner or a support person might say, that's not real, it's not there, there's no one there, that's just your mind. And for people experiencing this, it can contribute to shame. It can be even more distressing to hear that. So what I tell people is often not to correct. So we try to connect with the emotion that people are experiencing. I'll give some examples on the other slide, but if it's distressing for them when you're trying to say, no, that's not real, there's no person there, there's no cat in the kitchen, then that's not working, and we can try connecting and redirecting. And I'll give some examples. So for example, if someone is worried that they saw strangers in their bedroom last night and they truly believe there was a party in the bedroom, I had 4 people there that I don't know, you could say something like, that must have been really scary. I'm so glad they're gone now. So you don't have to say that wasn't real, that didn't happen. You can validate the emotion of being afraid when that happens, as we can all understand. I'm so glad they're gone now. Another example might be seeing children in the living room that you're worried about. Who do those children belong to? How did they get there? You could say something like, I'll go tell them to leave now. Don't even worry about it. I'm going to go tell them to leave. Let's go to the kitchen and get some lunch. So you're connecting, validating the experience, and then redirecting. Early on, when people have insight, when they might say something like, I saw a cat in the kitchen. I know it's not real. I know it's not there, but I saw it. That's okay to correct in that case. But as insight is lost, the experience is very real for people, and it can be distressing to keep telling them what they're experiencing isn't true. I often tell people, if you don't know what to say, that just listening may be the answer. So if you're lost for words, just allowing the person to express what they're experiencing and saying, thank you for telling me about that. Thank you for sharing that with me. That's enough. Number 9 is one important distinction with visual hallucinations is for some people, they may only experience visual hallucinations at night. And we need to distinguish those from very vivid dreams, which are common in Parkinson's. So some people experience what we call a REM sleep behavior disorder, where they have very vivid dreams with enactment. So punching, kicking, flailing, acting out your dreams at night. For people experiencing that, they may wake up and still experience part of that dream. So wake up in a vivid dream, still think that people are around them. But once they come to, they're fully awake, the lights are on, they realize that that was almost part of their dream that was continued. If that's what's happening, often we focus on treating that underlying REM sleep behavior disorder. Otherwise, if there's hallucinations happening at night, we often advise people to keep the rooms well lit, because dim lighting, things can sometimes look like something else, like a curtain might appear like a person. So how about having night lights in the hallway, keeping things well lit in the evening, and making sure that people keep up to date on their vision checkups. The last point that I was hoping to make today is that it's important to talk about it. Hallucinations and delusions are common in Parkinson's. This is a common problem. We call it a non-motor symptom, just like people experience constipation, bladder changes, daytime fatigue, mood changes. This is no different. And your Parkinson's team can help, but we need to know about what you're experiencing. You aren't alone in this. You can live well with hallucinations and delusions in Parkinson's, but the first step is talking about it.